Hi, I'm Dr. Neal Bhatia. I'm Director of Clinical Dermatology at Therapeutics Clinical Research in San Diego, California. So a couple of strategies on managing local skin reactions during photodynamic therapy starts with one very simple concept. Don't call them side effects. Call them anticipated local skin reactions so the patients are aware that things may be coming. And we do a few things before treatment, such as pre-treatment with some topical anesthetics like pramoxine or the things that might have a very low dose of lidocaine. I usually don't use lidocaine gel. There is a tetracaine prep that some people use, but again, the absorption potential could be a little bit toxic depending on how well they do. But using a few days of antihistamines, like 2 days before, I treat them twice on the day of, like the morning of, and then afterwards, and then 2 days after. Mast cell infiltration is a big part of the response in photodynamic therapy. So if you can slow down mast cell proliferation and degranulation, you can reduce erythema, some of the edema and pain mediators, things like that. It's very safe. During the treatment, obviously talk anesthesia is one of the best pain modulators you can do. Just start the treatment with them, hold their hand, ask them how they're doing at minute 1, minute 3, and be there with them, to talk to them and distract them a little bit. Obviously, in the room, there's a fan, that's above, which is helpful, but a little misting fan that they can hold underneath the light source that can mist their face really helps a lot. And then, of course, afterwards, you want to have like a nice, thick, medicated moisturizing balm, good cleanser, good sunscreen, and then just have them hydrate and make sure they're doing well. The day after, they have to stay in the sun for at least 40 hours, say out of the sun, excuse me, and then, of course, make sure they're optimizing moisturizing if they're having any peeling. A couple different tips I have again, if you have to stop at 3 minutes just to give them a breath, that's fine. It's not going to interrupt their efficacy. If you have to take a break and do 6 minutes, usually they'll plateau by 6 minutes. It's the first 3 minutes that usually gets things rolling. Um, and this is way off label, but you know what? I've had a couple patients bring some whiskey and a couple IPAs, and they pre-treated, and I say, as long as you're not driving yourself home, I'm okay with that. So if it takes some of the edge off, go for it, and then just make sure you're not driving yourself home. So needless to say, as long as they don't get too rowdy in the clinic, that's fine.